Okay, a couple developments this week. One, there was a report from China, then it was echoed by the World Health Organization saying that drugs like Motrin, NSAIDs, Motrin or naproxen might make a coronavirus infection more severe. How good is the evidence to support that claim?
Not good at all. The question was whether or not non-steroidal anti-inflammatories like ibuprofen, Motrin, in any way affect the expression of the angiotensin converting enzyme, i.e. ACE protein that sits on the surface of cells, which is the way in which that the virus attaches to and enters cells. So no, it was true then that non-steroidal anti-inflammatories increase the expression of that protein on cells, and that would only increase the ability of the virus to enter. I think there are no good data to support this. This was at most a hypothesis for which there is no clear evidence. My general bias on these things is don't treat fever, period. I mean, the reason that we all have fever is because our immune system works better at a higher temperature. There's certainly abundant evidence that if you choose to treat fever for a variety of infections, you can prolong and worsen illness. Actually, I have a book coming out in April called Overkill, When Modern Medicine Goes Too Far. And the first chapter is called Treating Fever Can Prolong and Worsen Illness. So I'm trying to make a case in favor of fever.
Mm-hmm. How about the chloroquine? Okay, so each week, this was the flavor of the week for the new treatment for COVID-19. Okay, that was chloroquine. In fact, I was watching a presser with President Trump where he said that chloroquine was effective in treating coronavirus. And then I saw Dr. Fauci roll his eyes. Is it true or false? Chloroquine, an anti-malarial drug, is effective in treating COVID-19.
Yeah, so who should we believe there?
Yeah,
Donald Trump or Anthony Fauci? That's a head scratcher. Here's what I would say. So hydroxychloroquine, an anti-malarial drug, is hypothesized to possibly work by altering the pH, which is to say the acid environment within a cell. That if it changes the acid environment within a cell to be unfavorable for the growth of viruses or bacteria, that it then could affect outcome. That product, hydroxychloroquine, certainly works in terms of malaria. When histoplasmosis first raised its head many decades ago, the hydroxychloroquine was also brought up as this possible wonder drug, and it wasn't. I think the chances that hydroxychloroquine in any way affect the outcome of this infection is small to none. I thought Tony Fauci was exactly right when he got up there and said, look, there is a standard of therapy. This is not that standard. We will test to see whether or not it works. And then, Donald Trump got up and said, I'm a big fan. I have a feeling about this drug. And then within 24 hours, Novartis promised 130 million doses that could be distributed worldwide. You wonder about just exactly what was going on behind the scenes that allowed those two events to happen, where Donald Trump says, I'm a fan, and within 24 hours, Novartis, promises 130 doses of a drug that has not been shown to work, and I suspect it's going to be shown not to work.